Good day. My name is Audrey Gittens-Gilkes from the Eastern Caribbean island of St. Vincent and the Grenadines. I am a registered nurse and a Doctor of Nursing Practice student with Duke University, Durham, USA. I am employed with the Ministry of Health, Wellness and the Environment in St. Vincent and the Grenadines as the Chief Nursing Officer. Today, I will share with you the challenges prostate cancer presents to the country. I will present a few facts about prostate cancer and the vision of the Ministry of Health, Wellness and the Environment for the management of this condition. Data from the Pan American Health Organization and the Caribbean Community Secretariat show that the Caribbean has extremely high rates of prostate cancer at a ratio of 28 per 100,000 population. Evidence further shows that black men have a 3 times greater risk of being diagnosed with prostate cancer than white men. The proposal is made for a national prostate cancer screening program in St. Vincent and the Grenadines. I discussed the matter with the Permanent Secretary in the Ministry of Health, Wellness and the Environment, Mr. Louis Deschamps, and the Honorable Minister of Health, Wellness and the Environment, Mr. Clayton Borgin. Mr. Deschamps is the Principal Advisor to the Minister of Health, Wellness and the Environment. He is the Chief Accounting Officer and leads the strategic and policy directions of the Ministry. Mr. Deschamps, as the Permanent Secretary in the Ministry of Health, Wellness and the Environment, how do you see your role in a campaign for a national policy for a prostate cancer screening program?
Sister Jules, good morning. Thank you for having me with you. I'm delighted that you have chosen to interview me on this very serious topic of prostate cancer that is affecting men in general, black men in this country. And I believe that given my role as one of the principal functionaries within the civil service structure in the health sector, I believe that I need to lead by example. I need to get the ball rolling so that we can sensitize the nation, men and women alike, about this disease which is the leading cause of death among men. Now, I believe that this ministry has to craft a program which is going to guide the citizens of this land as to how they might understand the need for men to have regular examinations, regular prostate examinations, that is every year, because it's known in the Caribbean, I'm not sure what it's like in the outside world, that men generally don't pay much attention to their health. And we need to understand that first of all, and appreciate that there's the need first of all to sensitize men in general, to get them to understand that when they get to 40 years old and young, that a regular test is important. We have to know what causes it. We have to also be aware of what we can do to offset it if that might be possible. But in my capacity as Permanent Secretary, I have to get my staff to understand the need for us to promote the whole issue of prostate cancer and to bring all men on board, not just when they get to 40 years old, but men as soon as they enter adulthood must have a huge understanding of what is prostate cancer and to understand that this can affect any of us as black men.
Having said that, will you support a proposal to offer tax break as an incentive to employers in the private sector who include in the terms and conditions of employment annual screening for all male workers between the ages of 45 to 60 years?
I'd say up front I will, because I just spoke to you about what we need to do, and I believe especially in the private and also public sector, annual screening really should become a part of our annual medical examination. But we first of all have to get men to understand that the annual check is important. When we have done that, then they must understand that as a part of it, the annual screening for prostate cancer, not just for the other major tests that are required, but prostate cancer must become part and parcel of that particular examination, which as men we have to undergo every year. And I will undoubtedly give support to that proposal.
Okay. Should there be a successful prostate cancer screening program, what implications will this have for the ministry, and how can we manage the challenges that may arise? There may be financial, if you foresee any financial challenge. What are some of the challenges you foresee?
Well, instantly I know that should prostate cancer visit the breadwinner for household, let's say, that person becomes incapacitated, that person becomes incapable of performing his regular daily professional responsibilities. It becomes a burden for us because, well, not just the Ministry of Health, but the nation, because that person will require the support, the financial support, the income support to assist the families, the extended family too, for example.
And as the principal policy maker in the Ministry of Health, will you have any final word, that final message that you would like to send to the men of St. Vincent and the Grenadines?
Oh, I want to tell all men in general who have attained the level of adulthood, that we have to start reading, we have to start asking questions, we have to find our ways into the clinics, whether it's the public setting or the private setting, to have that test. So I'm going to make a call for all men upwards of 21 to take this disease seriously. Get as much information as we can, visit the health centers, and make sure we get tested every year. That's the only way that the disease could be offset, if it's possible, if it's early enough, if it has been detected sufficiently early, then the medical and other health professionals can put systems in place to address it. But if we neglect to take the tests regularly or at all, then we just have to live with the consequences.
Thank you very much, Permanent Secretary, for the support of a national cancer screening program for men, and I know that with your support we will see a reduction in the incidence of prostate cancer in men in St. Vincent and the Grenadines. Thank you very much,
sister.